Welcome back to Tharani, I'm Joe B. Today I'll show you how to correct an extended sacrum from a flatback syndrome through joint mobilization techniques and exercises. Let's dive in. An extended sacrum is when the sacral base tilts posteriorly while the inferior lateral angles deviate anteriorly and gets stuck there. The cause of this can be due to repetitive, prolonged sitting posture and any pathology that can result to a decreased lumbar lordosis or a flat back posture. To treat an extended sacrum, position the patient in sitting with hip and knee at 90 degrees of flexion, feet together and flat on the floor. The therapist can be on either side, whichever hand is dominant. In this case, the left hand, so the therapist is on the right side of the patient. The left heel of the hand is placed on the sacral base while the forearm is placed between both shoulders. The patient is asked to externally rotate the hips. Once attained, the patient is asked to inhale, and upon exhalation, the patient is instructed to arch the low back to encourage sacral flexion. After that, the patient flexes the trunk against the therapist's right forearm resistance. The position is held for 6 seconds, while the left hand maintains an anterior and inferior force on the sacral base to flex the extended sacrum. After the resisted trunk flexion of 6 seconds, the therapist continues the sacral pressure for an additional 30 more seconds. The process is repeated 3 to 5 reps. This mobilization can also be done in prone, which we'll discuss in another video. Prone, seated, or standing anterior pelvic tilt exercises can be provided for the patient to reduce or eliminate the likelihood of a flat back or extended sacrum recurrence. This is performed for 2 sets of 10 reps and eventually progressed with addition of hold times. In addition, sit-to-stand exercises can also assist to stimulate the extended sacrum to move into flexion due to the occurrence of hip extension, anterior iliac rotation, sacral flexion, and increase lumbar lordosis during the activity. An extended sacrum can bring about localized nagging pain just above the ischial tuberosity below the belt line. There is also a feeling of buttock tightness and presence of a flat back posture. The assessment for an extended sacrum requires the patient to do sacral flexion, since inability to do it confirms that the sacrum is stuck extended. There are 2 bony landmarks to palpate: the sacral base and the inferior lateral angles. To palpate the sacral basis, the patient must be in a relaxed, erect, short sitting with feet flat on the floor and hands across the shoulders. The therapist should be behind the patient and eye level with the sacral base or L5 spinous process. The first web space of both hands palpates the iliac crest first, then both thumbs reach down and medially to palpate the posterior superior iliac spine or the PSIS. From there, the thumbs go up and medially by 1 finger breadth to arrive at the sacral basis. After that, the patient is instructed to arch the low back, resulting to sacral flexion and lumbar extension. Normal findings is that sacral bases move anteriorly or becomes deep under the palpating fingers. Abnormal findings is that sacral bases stay posterior or shallow instead of normally moving anteriorly or becoming deep. To palpate the second landmark, or the inferior lateral angles, also known as your ILAs, the patient and therapist position will be the same as with the palpation of the sacral basis. Both thumbs will slide down from the iliac crest to the PSIS. Then the dominant thumb palpates the S2 spinous process, then S3, and finally S4. Once the S4 is reached, the thumbs will go 2 to 3 finger breadths inferiorly and laterally to arrive at the ILAs. The patient is then asked to arch the low back, which results to sacral flexion and lumbar extension. Normal findings are that the ILAs move posteriorly or becomes shallow under your palpating thumbs. Abnormal findings are that the ILAs stay anteriorly or become steep. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Therani.